Welcome to the Adult Foster Care Policy, Training and Enforcement Section's training on caring for residents after they experienced a heart attack. Caregivers in long-term care settings play a key role in the health outcomes of those who are recovering from a heart attack or those with various heart conditions. Let's begin by discussing when a heart attack occurs. A heart attack occurs when an artery that sends blood and oxygen to the heart is blocked. During a heart attack, a lack of blood flow causes the tissue in the heart muscle to die. Some of the main signs include chest pain that may feel like pressure, tightness, pain, squeezing, or aching, pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes upper belly, cold sweat, fatigue, heartburn or indigestion, lightheadedness or sudden dizziness, nausea, and shortness of breath. It should be noted that women may have atypical symptoms such as brief or sharp pain felt in the neck, arm, or back. Sometimes the first sign of a heart attack is sudden cardiac arrest. It is important to know when to call the resident's doctor or when to call 911. If the resident has any signs of heart disease, call the doctor right away. Call 911 if the resident has chest pain, is extremely short of breath, or is displaying any other symptoms of a heart attack. Call 911 if you believe a resident may have lost consciousness. Angina is a symptom of coronary heart disease that occurs when the heart muscle doesn't receive enough oxygen-rich blood. Angina is not usually life-threatening, but it can be a warning sign of a heart attack or stroke. If you know a resident has angina and has chest pain that doesn't go away after a few minutes of rest or after taking prescribed nitroglycerin, call 911 right away. Caregivers in long-term care settings assist residents with taking their medications. It is extremely important that caregivers follow residents' medication orders as prescribed. Medication management in long-term care facilities involves more than just handing out pills. It's also about ensuring each prescribed medication is given at the correct time and dosages. Adult Foster Care Group Home Administrative Licensing Rule ending in 312 Subrule 1 indicates that prescription medication, including dietary supplements or individual special medical procedures, shall be given, taken, or applied only as prescribed by a licensed physician or dentist. Subrule 2 indicates that medication shall be given, taken, or applied pursuant to label instructions. Some common medications for heart conditions include beta blockers. These medications treat high blood pressure, heart failure, abnormal heart rhythms, and chest pain. They work by blocking a hormone in the body that slows down the heartbeat. ACE inhibitors. These medications help control blood pressure and make it easier for the heart to pump. Statins. These medications slow down the production of cholesterol in the liver and reduce cholesterol in the blood. Anticoagulants. These medications help prevent blood clots or deal with blood clots that already exist. Diuretics. These medications are also known as water pills. SGLT2 inhibitors. These medications decrease the amount of stress on the heart. Doctors commonly prescribe anticoagulants, antiplatelets, ACE inhibitors, angiotensin II receptor blockers, beta blockers, and statins after a heart attack. After a heart attack, medications play an important role in preventing further complications and possibly another heart attack. So it is imperative that caregivers assist residents in taking their medication as prescribed. Caregivers should encourage residents to attend regular appointments to discuss medications, side effects, and other concerns after a heart attack. Residents often need to take a combination of medications for a long time, usually for the rest of their lives. Caregivers can encourage residents to make lifestyle changes to prevent heart attacks. Some lifestyle changes to help prevent heart attacks are: don't smoke or use tobacco. Chemicals in tobacco can damage the heart and blood vessels. The risk of heart disease starts to drop in as little as a day after quitting. Get moving. Aim for at least 30-60 minutes of activity daily. Exercise lowers the chances of getting conditions that put a strain on your heart. Eat a heart-healthy diet. A healthy diet protects the heart, improves blood pressure and cholesterol, and lowers the risk of type 2 diabetes. This diet includes vegetables and fruits, beans or other legumes, lean meats and fish, low-fat or fat-free dairy foods, whole grains, and healthy fats. Some residents with heart conditions may be prescribed a special diet by their physician. A commonly prescribed diet for a resident with a heart condition is often referred to as a heart-healthy diet or cardiac diet, and typically includes a focus on low sodium, limited saturated fat, moderate cholesterol, and an abundance of fruits, vegetables, whole grains, lean protein sources like fish, and healthy oils like olive oil, while limiting processed foods, red meat, sugary drinks, and excessive salt intake. Adult Foster Care Group Home Administrative Licensing Rule ending in 313 Subrule 3 indicates that special diets shall be prescribed only by a physician. A resident who has been prescribed a special diet shall be provided such a diet. There are some other lifestyle changes a resident may consider in order to help prevent heart attacks. The first is maintaining a healthy weight. Being overweight, especially around the middle of the body, can raise the risk of heart disease. In general, a BMI of 25 or higher is linked with higher cholesterol, higher blood pressure, and an increased risk of heart disease and stroke. Getting quality sleep is also important. People who don't get enough sleep have a higher risk of obesity, high blood pressure, heart attack, diabetes, and depression. Most adults need 7 to 8 hours of sleep each night. Caregivers can encourage residents to consider making these lifestyle changes. Manage stress. Ongoing stress can play a role in higher blood pressure and other risk factors for heart disease. The resident should seek to find other ways to manage stress, such as physical activity, relaxation exercises, mindfulness, yoga, and meditation. The resident should be encouraged to get regular health screenings for blood pressure, cholesterol levels, and type 2 diabetes. The resident should also take steps to prevent infections. Certain infections can lead to heart problems, such as gum disease. Vaccines also help protect against infectious diseases. Feeling down after a heart attack is so common, there's a name for it: the cardiac blues. The cardiac blues usually get better with time and support. The following are some of the emotions a resident may feel after going through a heart attack. The first is feeling alone. Encourage the resident to reach out to their family and friends. Being connected is important for the resident's heart and the resident's general health. The second emotion is depression. The resident may experience moments of sadness, grief, or lack of hope after a heart attack, but depression is different. Depression affects everything and also increases the resident's chances of having another heart attack. If the resident is depressed, they should seek help from their doctor or healthcare team. The third emotion is anxiety. Anxiety is more than just feeling stressed or worried about having another heart attack. Anxiety can include strong physical symptoms such as a racing heart, feeling sick, or getting very hot and then very cold. If the resident is experiencing anxiety, they should seek help from their doctor or healthcare team. When a resident has a heart attack, there is a lot you can do to provide emotional support to them. First, try to understand how the resident is feeling. By understanding emotions, you can offer support. Also listen if the resident wants to talk about the heart attack and how they're feeling, but don't rush to give advice. Educate yourself. Help the resident research their condition. Help the resident put together a list of questions to ask their healthcare team so they can feel empowered. Encourage the resident to socialize with others. Talk with the resident and encourage them to talk with others. The following are some ways to help the resident manage their emotions following a heart attack. Encourage the resident to get up and get dressed every day. Encourage the resident to go for a daily walk. If the resident's healthcare provider has given the resident exercises, be sure the resident is completing these activities. encourage the resident to return to normal hobbies and social activities. The resident should take things slow and increase social activity as they feel up to it. Encourage the resident to share their feelings. Encourage them to speak with a friend, family member, counselor, or support group. Make sure residents get a good night's sleep. A lack of sleep can cause residents to feel tired or irritable. Encourage residents to participate in a cardiac rehab program. Emotional support is one of the benefits of this guided activity and education program. Encourage residents to ask questions. If residents have questions, encourage them to speak with their healthcare team. Learning about heart disease and how to live with it can be empowering for residents. Thank you for learning with us today. Remember, caregivers play a key role in the health outcomes of those who are recovering from a heart attack or who suffer from a heart-related condition. We hope you found this information helpful. To complete the quiz that goes with this presentation, click the link located in the information box below this video.